Right, wonderful. So welcome to the prize competition. I'm going to skip all this. The presenters, I want to introduce you to the judges, and I appreciate judges for taking time. We have 4 judges. Ann Allen, she's a program officer at the Bill and Melinda Gates Foundation. Professor A.J. Anato, he's a faculty of pharmacy, University of Benin, joining us from Nigeria. Molly Guy, senior program officer for NCDs at PATH. And Professor David Catarere from Department of Pharmacy at TUT in Pretoria. So the way we'll run this, as you have been notified, that you have about 25 minutes to present, followed by Q&A from the judges, and then participants may ask the questions. For participants, if you need to ask a question, raise your hand, or we are a small group, so you can just unmute yourself and speak. But let's first give the opportunity for the judges to ask questions. So we have 2 talks today. So supporting the Malawi Ministry of Health to adapt the public health supply chain to respond to COVID-19 effectively and efficiently. And I believe, and correct me here, that I need to play the video because you have recorded already, and then you will feature Q&A, right? Okay, so let me do that. And I have the video. Now sound and video coming through?
Yes, it's good. Thanks.
COVID-19 has dramatically impacted our world, in particular the global supply chain, and underscored disparities in health access. The U.S. Agency for International Development works to maintain health services, improve COVID-19 vaccine access, and reduce global health inequities during the pandemic. As part of those efforts, USAID's Global Health Supply Chain Program, Procurement and Supply Management, or GHSC-PSM project, provides technical assistance to support vaccine rollout in approximately 20 countries. One of these countries is Malawi, where since the start of the pandemic, there have been over 60,000 infections and more than 2,000 deaths from COVID-19. The GHSC-PSM project provides health supply chain support to the Malawian Ministry of Health as it responds to COVID-19. This support was expanded in 2021 after USAID donated $500,000 to support vaccine deployment to include 3 key areas, which are technical assistance, commodity warehousing, and distribution.
And Malawi being a resource-limited country, we don't have a lot to go around. We could say that by us supporting the vaccine deployment plan, it creates, space for other resources that may have been put there to be used for other programs that still need support.
The project and government of Malawi have gleaned many lessons as they work together to deploy vaccines across the country. GHSC-PSM's work began in advance of Malawi's first vaccine shipment. The project coordinated across Malawi's Vaccine Logistics Committee and National Task Force to gather and share information and decisions about vaccine rollout. The project and the Ministry of Health's expanded program on immunization, or EPI, used this information to develop and implement a national vaccine deployment plan. The plan leveraged GHSC-PSM's existing framework and resources to secure timely planning and distribution of vaccines and supplementary supplies. As the commodities were being stored at warehouses throughout Malawi, the team worked to fill gaps in vaccine data tracking caused by low data availability and poor data quality. GHSC-PSM designed, printed, and distributed paper-based logistics data capturing and reporting tools. The paper-based tools included stock cards, which allowed healthcare workers to track vaccine consumption data, which was then entered into vaccination cards and reporting forms. The project also recommended updates to the country's Electronic Logistics Management Information System, OpenLMIS, for vaccine tracking. This would enable EPI to track vaccines and their supplementary supplies more efficiently and effectively. Following government endorsement, the project configured the system to do just that. The data from physical vaccination cards and reporting forms were fed into OpenLMIS to ensure that there was both a physical and digital record, as many smaller health facilities do not yet have access to OpenLMIS. The project supported distribution of vaccines to 28 districts through technical assistance and by covering logistics, cost, and fuel. GHSC-PSM also helped redistribute vaccines as stock imbalances emerged to reduce wastage and maximize vaccine use. The distribution process included proper waste management practices. After developing guidelines to govern reverse logistics, the process of withdrawing or recalling commodities from facilities for disposal, and centralized disposal of vaccine waste, the project helped train health workers and facilitate certificates to acknowledge correct disposal procedures.
Obviously, you'd expect that with a large-scale vaccination activity like this one, a lot of medical waste would also be generated and would want the health facility staff to responsibly dispose of this waste.
Proper tracking of vaccines helped to mitigate low uptake in some districts, coupled with the short shelf life of some of the delivered vaccines. These tools helped prevent wastage through redistribution, leading to 96.3% of the total 512,000 vaccines being administered. GHSC-PSM is using these steps and lessons from vaccine rollout in Malawi as a framework for deployment in other countries. When coordinating vaccine rollout, joint planning and information sharing among key partners are critical to avoid duplication of efforts and identify gaps around distribution, waste management, and data collection. The subcommittees in place from this first rollout can serve as a guide for what a successful implementing team looks like. For future vaccine delivery success, ensuring that in-country supply chain structure is comprehensive enough will be key, along with having the right teams involved at all levels of the supply chain and regular communication. Any gaps will need to be identified in advance of the rollout, and adjustments will need to be made. During distribution, any overstock or wastage must be tracked to allow efficient redistribution. This will reduce wastage due to expiry. Advanced communication on remaining shelf life before receipt helps with stock planning and avoids wastage. Additionally, wastage can be avoided through widespread vaccination campaigns and other social behavior change communications to encourage vaccine uptake. Lastly, GHSC-PSM drafted waste management guidelines and standard operating procedures based on the WHO guidelines for future reference and waste management operations. These elements should be incorporated into a clear vaccine distribution plan. For example, Malawi's plan takes into account the following: identification of the key actors and how and through which channels they will regularly communicate with each other to implement the rollout. All standard operating procedures are approved, provided, and available. Data collection methods and resources are available and accessible. Trainings provided to supply chain and health workers prior to rollout at each point along the supply chain. Contracts with external entities are in place along the supply chain, such as third-party logistics providing additional distribution support. Warehouses have proper storage for commodity types. Through these approaches, the rollout support structure can be applied in other countries and regions. Ongoing assessment will also help to mark points of success in the process and identify where improvements can be made. Together, we can continue to adapt and innovate the supply chain to fight COVID-19.
Okay, Charles, is there something else you want to say before we move to question and answer session? If you could switch on your video, please.
No, not at the moment. I think we can proceed to questions and comments.
Yeah. So I'd first defer to the judges for questions. Please switch on your video when you ask a question, or all the judges, I would request you to switch on your video. And feel free to unmute yourself and ask the question. So Charles is the presenter here.
If I may go first. Thank you very much to the team, Malawi team. So I just wanted to find out what exactly is the innovation? It wasn't very clear to me. So maybe you could just briefly outline the innovation here.
Should I take the question, or we wait until we have a number of questions? We need to be guided.
Yeah. Maybe let's take a couple of questions. Any other question from other judges, Inato, Anne, or Molly?
This is Molly. I guess I had a similar question kind of around the cold chain implications. So to the question that was just raised, were there specific innovations or modifications that were needed around cold chain and storage and lessons learned there? Thanks.
So Charles, let's take those two because those are both around innovations across the supply chain. Appreciate if you can respond.
Okay, thank you so much for the questions. Essentially, the two questions are one and the same, but I'll try to expand. First and foremost, it is highlighted in the presentation that the Global Health Supply Chain Program in Malawi basically operates through 3PL. And so the 3PL is meant or was designed basically to warehouse and distribute commodities around malaria, HIV, reproductive health, maternal and child health. COVID-19 was an emergency, and so it was not on the agenda. But when we started responding or supporting Ministry of Health to respond to COVID-19 pandemic, we were able to quickly adapt or support Ministry of Health to quickly adapt the agreement or arrangement with 3PL to accommodate COVID-19 issues. And because of that, we were then able to move forward. Otherwise, without that, it would have been difficult to manage COVID-19 commodities. But again, in the presentation also, it's highlighted that we were able to change or adapt the Open LMS. Open LMS is a system that we use for managing data in the country. That's basically support that is being provided to Ministry of Health by USAID via the Global Health Supply Chain Project. And so again, this system did not take into account COVID-19 because COVID-19 did not exist at that point in time. So with the coming of COVID-19, again, we were able to adapt the system so that we can then be able to track, report, but also be able to order COVID-19 vaccines. So there are quite a number of issues. We also talked about waste management. For the first time, we were able to quickly work with Ministry of Health to develop guidelines to dispose of the waste that was generated from the vaccines that came. No one had an idea prior to that. We didn't have the system in place, and so we were able to quickly work with Ministry of Health to develop the guidelines to help us dispose the vaccines, the waste from the vaccines. That is.
Okay. Other questions?
Yeah, thank you very much for the video and your response to a couple of questions. I mean, the last two questions. Yeah, I think I may want to reiterate, I find it difficult to really identify the innovation in this project. More or less, I see more like a strategy to prevent wastage, because from the presentation, a lot of the vaccines were already short-dated at the point of at the time they landed the country. So without this strategy to redistribute the products, perhaps the wastages would have been more than what you experienced. So maybe the title could actually be something like, strategies to prevent wastage, from COVID-19 vaccine, right? So, so I think that's what I can see from the work.
Was there a question, Nato, or just a comment that you made, which is, of course, important?
Yes. So more of a comment question. Yeah, but he's free to respond if he wants to clarify my understanding or my doubt. So he's free to respond to that.
Well, I think that's your understanding from your perspective. But running through the video, you will notice that the issue of waste management is just one component of the whole presentation. And so we need to appreciate that there are quite a number of other issues that are coming out besides just focusing on waste disposal. So I would still say that there are a number of issues that I talked about. For instance, the adaptation of the open airline mines, but also the adaptation of the 3PL arrangement to accommodate warehousing and distribution. But I appreciate your point. It's just one of the issues in the presentation. Thank you.
Thanks, Charles.
Yeah, if I may just add a couple things I've agreed with the comments and questions from the other judges. I guess my question to have a little bit more clarity on this work is sort of how does this differ from how routine vaccination and other vaccines in the country are currently being managed? I think that would help us clarify a little bit of how and why this was different. Particularly if you could speak to any of the analysis around key performance indicators, improvements in performance for the COVID vaccine versus other vaccination efforts would be interesting, although understandable if that data is not yet available. You spoke, for instance, of wastage averted due to redistribution. So potentially you could speak to what exactly the value of that wastage averted would have been, although your the percentage of administered vaccines is still very high. It would be interesting to hear what your intervention resulted in terms of wastage averted, understanding the short shelf life that many countries are struggling with at the time of entry into country. Over.
So Charles, before you respond, actually, so just want to add to what Anne was asking. This is what was going through my mind as well. That is, and this is connected to the first set of questions around innovation. So, clearly this is vaccination. So there is a routine EPI program already in place. And you talked a lot about lots of stuff needed to be done. Is the nature of the stuff that needs to be done simply a scale-up problem? That is, every time I introduce a new product in the existing channel, there are lots of stuff that needs to be done. Or did it also mean you mentioned about supply chain structure, appropriate actors? Are the set of actors different who need to be brought to the table? Because you already had 3PLs before. It's just a question of asking them to carry more product in a more emergency fashion. So I think that clarity in terms of comparing with the existing immunization structure, overlaying on top of that, what did COVID kind of bring about? And the reason also it's an important question because these are in other conversations. There was a lot of discussion. I was in the National Academies Committee where could existing structures be used for doing COVID-19 vaccinations? Because there is a cohort problem also. There is a supply problem, there's a demand problem. How do you identify a cohort? Because the cohort is very different in the, so those are the, I mean, if you could address to that, and then of course, the second part of Anne's question was around KPIs, and yeah. Over to you, Charles.
Okay, thank you so much. There are quite a number of questions, so I'll try to respond. If I forget some of them, then let me be reminded. I think the first issue was around the issue of how different is the vaccine supply chain from the other commodities. Well, as I indicated earlier on, this was an emergency, and the systems in Malawi did not plan for it. They didn't think about it. But the fact that once we started responding to the emergency, we were able to quickly bring different stakeholders to the table, discuss quickly and agree that we have an emergency amongst us, and we have to act leveraging on resources from the different stakeholders. We are all aware that vaccines require cold chain storage. Usually these issues of cold chain are not regular like in other products. They come once in a while. And so being an emergency, we were able to work with the EPI, which is the official department of Ministry of Health that deals with vaccinations, to take into account issues of vaccine storage so that we can be able to distribute in good time to the various areas. In terms of issues of data, being an emergency, there was no data prior to the the coming of COVID-19, and so planning was difficult. We are all aware that for us to be able to plan effectively, for us to quantify commodities, for us to be able to procure, for us to be able to distribute, we need data. But here we had a situation where we had nothing on the ground. There was no data at all, and so we were working basically in an environment where there was basically no data. We had to start from scratch. And that's why we supported Ministry of Health to come up with tools that we should be able to systematically track the distribution of COVID-19 vaccines and be able to track where they are going, but also to look at the trends in terms of the numbers of people that are being vaccinated, where the commodities are going, but also there were occasions where issues of demand and supply, some places did not have, or they had more supplies than others. As I said, we didn't have figures at the beginning. And so in some places, the consumption was higher than in others. So we were able to quickly look at the figures that were coming from the field based on the tools that we had developed and be able to relocate some of the vaccines to areas that needed them more than others. But that, of course, being a first initiative, it was not easy. And as I said, that's why we adapted the open LMIs so that it can help us to more efficiently and effectively track the data that is being generated from the sites. Not sure if I missed anything.
So I think on the KPI side, I think it would be, because in EPI, because one innovation, I think what you emphasized in your video also was this, rebalancing stock, moving stock from one place to another. I don't know if that happens routinely in Malawi in EPI. If it doesn't, then perhaps one comparison could be what is the wastage that you see in EPI versus what's the wastage? I mean, you talked about 96% right in your video. So that may be useful comparison, though it's tricky because COVID vaccines came with a shorter expiry date, etc. So do you have a sense for what the wastage is in the regular routine immunization program in Malawi?
What's the last bit of the question?
Do you have a sense for what is the wastage in routine immunization in Malawi?
I think we are new in the COVID-19, and we are still trying to explore. So I guess maybe once we critically look at the data that is coming from the field, we should be able to sit down and re-strategize. But at the moment, I think we are still in the phases where we collecting data and trying to see what is happening.
Yeah, fair
so
enough.
It would be probably a bit premature, I think, to look at it from a more analytical perspective.
Understood. Other questions from judges or from the audience? Anybody from the audience wants to ask a question? Please unmute yourself and ask the question. No?
My name is Henk den Westen. Good evening.
Yes.
I was seeing that the announcement was made under price competition. So I'm not sure whether we have left that or I missed, some information about price competition and whether they have maybe made any basic assessment what the price was and what price, what competition has been established so that prices have moved in one direction or the other.
Sorry, I didn't understand your question. Is the question to the organizers or to the speaker?
My question is to the organizers, because if you see the program on track 1, this is announced as price competition, 2 presentations, and yes. I didn't see any subject on the price competition in the presentation. So am I in the wrong session or?
This is the price competition. This is the talk 1 of the price competition you just heard.
Yeah. So what was the price competition established in the distribution in Malawi? That's my question then.
Well, you heard the talk about the distribution, so I don't know what your question is. If what the criteria for price competition, then I think we can talk offline about that. Any other questions?
Ravi, this is Molly. There's a great question maybe in the chat. I don't know if, and I think Anne flagged it as well. So maybe we could just bring that one forward because I think that'd be great to hear. Thanks.
Yeah, so Charles, there's a question. Just want to know the mechanisms, what mechanisms are in place to ensure that the gains you have made on vaccine supply chain will be used to improve routine immunization program. Right, so you talked about innovations that you have brought about over and above what was being done. What are the mechanisms that you're thinking about to ensure that these gains will remain to improve even the routine? So what is the learning for how to improve the routine immunization from this initiative?
I think first and foremost is the issue of collaboration, as indicated in the presentation. If several partners were able to come together, plan together, use their resources for us to be able to move forward the vaccine agenda. So I think collaboration is one thing that we've learned from the experience, that without proper coordination among various partners, since all of us are operating parallel supply chains or different products, I think it's important that we coordinate our efforts and we leverage our resources for us to move forward. We've also seen that I think the other mechanism for us to sustain this is to ensure that the systems that are in place, we have policies, we have standard operating procedures that should be on standby. So if the pandemic continues, then we should be able to use those standard operating procedures and guidelines for us to move forward, go back to the drawing board, because now we already have the systems in place. I think it will be easier to move forward. I think those are the 2 key issues, but we also talked about issues of data management. It is critical that we probably go back and review the data tools that we have and ensure that they're up to date, so that as the pandemic continues, we should be able to have ready tools for us to use in terms of tracking, reporting, but also commodity ordering. I think those are 3 important mechanisms.
Great, thank you. I think one last question before you close in a minute. There is a question in the chat box about what gaps remain as you've kind of done these innovations. What do you think are still some remaining gaps and adjustments that will be made to the needs to be made to the supply chain? If you could do a quick
one of the key.
Yeah.
All right. So one of the key gaps is the issue of staff capacity. We are operating in an environment where the Ministry of Health doesn't have adequate staff on the ground to manage supply chain management. So it's a critical issue that we need to look at in terms of numbers, but also skills, so that we can effectively and efficiently manage COVID-19. I think that's one of the critical gaps that is currently challenging the country.
Wonderful, thank you. And at this point, I would like to thank you, Charles. Again, let's give a good round of applause for Charles for his presentation. We will move on to the next talk. This is titled Quantitative and Qualitative Gains of Electronic Proof of Delivery, called ePOD, a case of Kenya Medical Supplies Authority towards a reliable health supply chain. And I believe, Martin, are you going to present? Are you sharing, or do you want me to share the slide deck that you submitted?
You can share.
Okay, I'll try. Let's see. Just 1 second. Okay, you can see that.
Right. Is it visible?
Yes.
Right. Thank you so much. Greetings from Kenya. My name is Martin. I want to present to you part of what we've been able to achieve as a supply chain, the health supply chain. And it's titled Quantitative and Qualitative Gains of Electronic Proof of Delivery, a case of Kenya Medical Supplies Authority. And it's geared towards a reliable health supply chain. And quickly, this will be my, let me put in presentation mode. Yeah, so I would want to take you through a brief introduction, goods in transit tracking mechanisms that we have, the motivation for our project, the problem that we wanted to address, the interventions that we have, how our ePOD works, and the implementation challenges, the achievements, and the recommendations at the end of the day. So basically, to take you through Kenya health supply chain context, we have key stakeholders, implementing partners, 10,000 SDP supply, that is service delivery points, then KEMSA. Then we have at the middle of it that turns the cog, the funding that comes through the donors and the government of Kenya. Then one other stakeholder is MOH, and Kenya is divided in 47 counties, which are semi-autonomous. So KEMSA is a state corporation that is mandated to be able to supply, to procure, warehouse, and distribute, and that is more of the supply chain management key functions that we carry out on a daily basis. But the intervention that we are talking about in this price competition is about distribution. We have under challenge in terms of how distribution is carried out in the health supply chain. And we developed an implementation mechanism to be able to arrest a number of issues that I'll be able to address as we progress. And the many interventions that we've put in place to ensure that there is traceability and visibility of goods in transit is that we have 3PL GPS-enabled tracks, and then we also have daily SLA performance reporting by the 3PLs, and then we have in-transit tracking through a route management system. This route management system that is GPS-enabled, and the goal of the distribution function is to ensure there is on time and in full delivery. And the intervention that we put in place was to ensure there is real-time delivery reporting via KEMSA POD, that is a proof of delivery, because the challenge that we had is that once the goods have left KEMSA, then we are not able to see until the day when the transporter reports back, probably a week after. And that was a major gap, loophole, because it would leave us wondering where the commodities or where the HPTs are as they move through the country. And so the motivation was to enhance a last mile accountability and real-time visibility of outbound processes from the time the order is received to the time when it is when it has been delivered at the service delivery point. So we wanted to enhance traceability of goods in transit, because there are instances where we had pilferage, we had trucks being lost on the way, and we couldn't be able to account. And that's the reason why we thought probably visibility of goods in transit is very critical for us to be able to deliver commodities where they ought to be delivered. So we had long turnaround times of return of POD, 2 to 3 weeks, as I mentioned. Once the 3PL picks the drugs from KEMSA, then we will wait until he's come back and deliver back the hard copies, because our delivery notes are in 4 copies. So there's the original one that is left at the facility. There's one that goes with the 3PL that brings in for finance reimbursements, and there is the yellow copy that is left in KEMSA, and there's a blue copy that comes back as POD, and that would be a huge gap, such that once we have released the goods, we have no visibility of where the goods are until when those hard copies are brought back. And so the other problem is that there was lack of visibility of goods in transit, that is GIT, and then cases of pilferage that came by and we could not be able to account, because the driver says I delivered, the facility says I received. So there was a lot of gray areas in terms of, because of that lost period of time, once we don't know if the commodities were delivered or not. So we could not ascertain the whereabouts of in-transit consignments unless through phone calls with drivers and facilities to confirm deliveries. So there are instances where even the transporter will take longer to return the hand copy PODs, so we are not able to know exactly if those commodities were delivered. So the intervention, I would want to invite my audience, if maybe probably at your free time, if you have an Android phone, unfortunately we've not enabled this application on iPhones, but if you have an Android phone, you can search in KEMSA POD, and it is there in the Play Store, so that you are able to see how the application works. So we wanted to have a sustainable, very affordable model to be able to ensure that we have that visibility. So it is a mobile application hosted in Google Play Store, and that is connected to our warehouse management information system. So that the beauty of it is that this system is locally developed. It's an application that is locally developed by local talent. So it is not anything that is without the reach of medium and low-income earning countries. So on one end, we have a WMS, which is the Warehouse Management Information System, that is linked now to the application. So that I would want to quickly just to show you how the application works, so that I can be able to progress. So, Dr. Ravi, is my screen visible?
Yes.
So to ensure that this application is taken up very quickly, we developed a video clip and posted it in YouTube, so that anybody who wants to learn how to use the ePOD can just log in and be able to see how the application works. So basically, you require a smartphone, internet connectivity. Just close all the apps in the background where there is no internet. Then you download the KEMSA ePOD from the Play Store and install in your phone. Then it will lead you to where you a very simple way to, we provide you with login credentials so that you're able to log in. Then step 2 is you tap on receive and confirm. Then the app takes you to a scan function, which is currently pending availability of barcodes, so that you just reverse back. And then you quickly be able to enter the delivery number, note number in full, as indicated in the paper documents. So when you put in the delivery note number here, then it tells you, it takes you to a place where you need to search. And now the mobile application searches the information from our ERP, and it actually shows the recipient person what is being received, all the quantities are being received, so that they're able to confirm exactly what is in the hard copy and what is in our system. Then after that, you are able to enter the receiving staff details as indicated in the delivery note, so that you are able to also capture if there is any comments that you need to comment. And there you go, you click delivery successful. Now, once that is done, let me go back. Let me share. Right, I'm okay, Dr. Ravi?
Yeah.
Right, so that's the simple user guide. It's a very simple way to be able to deliver. And maybe to mention that it is now able to scan because the boxes have barcodes. So all you need to do is just open the scan function. It scans the barcode from the box, and it loads all the details of the delivery note. And whoever is receiving is able to confirm whatever is in the delivery note and whatever is in our system, and very quickly be able to. When they click that and complete the receipt process, that data is on a real-time transmitted back to our headquarters, and we are able to see that today we received this number of orders, so that there is no loss. For example, if a transporter is taking 3 days, we are able to see, because the system is able to show us on a daily basis and it's sending email alerts of what is being received at facility. Allow me to continue. So the basic requirements of this application is that you just have to have internet connectivity and the smartphone. And in terms of rollout, we thought probably the facilities would be able to, the people receiving, but it turned out to be very expensive to be using the application, but it turned out to be a very expensive model. So what we did was that the person using the application is a driver, because he's the one who is transferring ownership of commodities. So the drivers have their credentials, they have been trained by the 3PL. The responsibility of training the drivers was shoved to the 3PL, and we are now able to make it very easy. If a transporter brings in a new driver, we just share with them the YouTube application. They just learn it very easy because it's a very end user friendly application, and we are able now to have real-time visibility of goods being delivered. In the minute they click in that it has been delivered, that we are able to see that. So upon the confirmation, the driver enters the receiving officer's details, and that is key, because before, when the hard copies were coming, sometimes they have misspelled the hard copies because the carbon copy was not put in very well. So sometimes, for example, we will actually miss out to know exactly who received. But the AU ePOD has been able to help us build customer database, because all the details of the receiving officers are keyed in, and we have that visibility. And that information is relayed to the distribution in the distribution metric reports on a daily, on a real-time basis, and we are able to confirm those deliveries so that the driver cannot has no chance to lie or probably give an excuse why he has not delivered, because this is made it very visible. So part of the implementation challenges we encountered is that 3PL drivers with no smartphones. So you realize not everybody has the privilege of having a smartphone. So that was a challenge. Then lack of internet connectivity in some parts of our country. System downtimes sometimes. And then sometimes when we initially logged in, launched it, we had, it was taking a little bit of time to be able to fetch in and upload data to the WMS, but we are able to surmount these challenges. Over time, the 3PL, the transporters saw the value because they are also able to track their drivers. When the driver says they have delivered or not delivered, the data is able to show them. So the 3PL saw the value, and they actually facilitated drivers to have smartphones. Sometimes where there is lack of internet connectivity, that still was a challenge. But the mitigation was to be able to tell the drivers, in case you have an internet issue, then you before you can proceed with your deliveries. But the moment you reach to a town where you have internet connectivity, then you upload in the data. System downtimes, it happens, but it's not as frequent. And sometimes it took too long for the drivers to log in and punch in the data. And how we mitigated that is that we, as I mentioned, we put in a scan function so that you don't have to waste a lot of time punching in data. We put in barcodes so that you just take up your phone, get to the scan function, you scan the barcode, and the application loads up all the data that you require and make it a little bit easy. So when we began, the turnaround time of proof of delivery was 15 days. Sometimes we take 45% return of hard copies. So we have, for example, all month when we don't know exactly if there was deliveries that were made. Then there were also deliveries delayed in terms of payments of transporters, because payment is tagged upon return of delivery, of proof of delivery. So if they delay, then there's a lot of time that is lost. Then when we began, the uptake of the app was 16%, as that is August, by August 2021. But through a lot of training, a lot of engagement, we have seen that come up. Just want to show you at the end of actually October, that is last month, we have we had an overall ePOD performance of 80%, so that we can comfortably say that we have 80% of orders delivered, and we have that visibility. So, and how we've been able to motivate the transporters to use is that we pull in this data, we analyze this data on a daily basis and post to them. So that when they see, for example, one of our 3PL is Harry and Stan is doing 99, and down here there is Sign Enterprises that are doing 51. They keep themselves motivated because this is part of SLA, the service level agreement, so that we are able to see that visibility. And we actually, as we speak, we are close to 90% in terms of the performance of the ePOD. So key achievements, the gains I talked about is that we are now having real-time visibility of proof of delivery and accountability. Since the launch of the POD data, the app, there have been no reported cases of pilferage because there is increased visibility. So on average, the distribution lead time has improved from 12 days, that was in May, actually to an impressive of 3.03 days, that was in mid-October 2021. So the ePOD has also helped transporters to track the movement of the performance and the performance of the drivers, and the real-time access of data to facilitate quick evidence-based decision-making has been made possible. So the M&E team is now able to review POD data and resolve any emerging customer issues and reschedule distribution when required. There has been reduced customer complaints because ePOD has enabled facilities to verify the quantities dispatched from KEMSA and those delivered. Actually, before, there was an incident where we had an alteration of delivery notes, where the driver or whoever, I don't know who, we cannot be able to trace who altered the delivery note, so that whatever is being received at the facility is not what released at KEMSA. So there was an issue there. So the other major improvement and achievement that we've done is the elimination of manual data entry and errors. When all the earned copies come on board, and remember we have like 10,000 service delivery points. So we have a lot of manpower, people looking through the POD, trying to key in data every now and then, and that's a lot of waste. Nowadays, that is not a case, it's no longer happening because all that data is coming electronically. So again, there is a streamlined on-site delivery process because the POD guides the driver on what to do, because the process is very clear. We have an SOP on how to receive drugs. So it is very clear from one step to another. So there is no mishap in terms of probably the contacts were not captured, or the ID was not captured. And we have accurate capture of complete customer data, as I mentioned. Now we know who received because that data comes in electronically. The other achievement is that POD is a vital part in both of the delivery process and has ensured supply reliability, because we know that once you deliver in good time, then the last mile part of it has been completed effectively. So health supply chains, in my thinking, should be able to leverage technology and local talent to supply maturity. So that using local talent without having to spend a lot of billions to build in, to bring in expatriates, we have a lot of talent in Africa that we are able to utilize to be able to solve our own challenges. And this is a cost-effective issue, cost-effective model. It is developed in country and be able to tapping into the pool of talents within our country and be able to see that we are delivering value and leading to supply chain maturity. So my recommendation is that with rising customer expectations for transparency and accountability, so I believe that electronic POD through mobile application is a step forward towards the maturation of the supply chain. And I know there exist many ePOD solutions, but most cannot fit into the public health supply setup. So a tailor-made solution is something I want to recommend to, especially in our continent. And I know we will be available to be able to transfer knowledge and also help countries that will be willing to try this model because it has worked for us, and be able to see that we have that last mile visibility that we so much require. So thank you so much, Ravi. That's all I had. I had to rush to be able to cut on to deliver on time. Back to you, Ravi.
I was muted. Could you stop sharing your screen, Martin? Thank you so much for your presentation. I will open the floor for judges for questions. Molly, Anne, Renato, David.
Yeah, thank you, Mr. Martins, for that very nice presentation. Just a few questions, right? I'm just wondering whether in case of reverse logistics, does it take care of that? And also related to that, what about goods damage on transit as well, right? And the redistribution. So just wanted to find out if your new system is able to address those things.
Just hold off on that, Martin. Let's see if Molly or Anne have any questions.
That was the same question I had, in fact, just about how sort of incomplete, partial orders or back orders were managed, as well as damaged goods. Interested to see what the learnings are. Redistribution, I think, is an additional aspect that Mphatso highlighted that would be good to learn about.
Molly, you have something
Yeah,
to add?
thanks. Yeah, thanks, Martin. I guess, so my questions are kind of around next steps. So I'm curious about, it sounded like it was low cost for development. I'm curious about kind of the costs for upkeep and kind of what sort of revisions are needed continuously. And then I'm also curious if you kind of built everything into it that you wanted in this go around, or if you have a phase 2 envisioned. Thanks.
Okay, Martin, take it away.
Right. Oh, thank you. Thank you for the very good questions. I will respond to the question about if the application is able to manage reverse logistics, damaged goods, and also redistribution. Just to mention, the way our supply chain works is that we have outsourced our distribution function. So, and part of what the 3PL are able to give back to us as a supply chain is that in terms of reverse logistics, they do not charge us. Just to give a case scenario, what happened actually this morning, we were delivering nutrition commodities, and when we go to the facility says, "Oh, I cannot pick up all this because there is the issues of storage." So what happens is that the driver captures that data in the ePOD. There is a comment section where they say, "I have delivered these commodities. The facility has declined to take 2 or 3, so I am bringing back 4." And that data is relayed back to us so that we are able to visualize that, yes, there is a return that is coming on board. So the app is able to manage reverse logistics, because we are able to get that data on a real-time basis. And as I mentioned, the way our reverse logistics works is that the transporter, kind enough, in case there's any cases of returns, then they're able to reverse to return back to us. Now, in the event where there is what the facility has in store and want to return back, the application does not come in that aspect. So the application only works in the times of delivery, because there are other mechanisms of reverse logistics that we have that are more comprehensive. So regarding damaged goods as well, if in the event at the point of delivery there's damages or losses, that information again is captured by the ePOD. Both if there is an issue in terms of disparity between the receiving officer and the driver, then that information is captured on a real-time basis, so that we're able to know that 2 or 3 goods were damaged, and we are able now to be able to get mitigation measures. But again, on the hard copy, all those comments are captured, but the ePOD helps us to capture that data on a real-time basis, and we are able to make decisions at that point. If they are damaged goods, then probably we are able to either say, let us do a back order, or let us be able to say to investigate why the damaged goods have been the goods have been damaged. For redistribution, no, the ePOD does not assist in redistribution. The other mechanisms are in place for redistribution. Now, regarding low costs in terms of development, the upkeep, and if it is a phased approach, I'll tell you, we have hired software engineers, an engineer that is just on normal remuneration like any other person within the organization. Their job is to develop softwares that are tailor-made for our supply chain. So in terms of upkeep, it is maintained by our internal software developers, and it is in a phased mode because we've taken a lot of time to develop it. The other application. The next phase is to be able to ensure that it is GPS enabled, so that we are able to tell that this application was used at a specific location. And we are in the process of procuring GPS capacity and capability to be able to ensure that. So it is a phase in a phased mode, being developed within our setup and being kept and being upgraded within our setup. I think those are the questions I respond to. Back to you, Ravi.
Thank you, Martin. Any other questions? David, did you have a question?
Yes, I did. Sorry, I dropped off. Something happened, but thank you very much. I really enjoyed that because I think the problem you're trying to solve was very clear, and the solution was also a bit clear. The one thing that strikes me is, so you've generated intellectual property, IP around this. Do you plan to share this with other agencies in East Africa, or even with your local pharma industry? Because I'm sure the pharmacies have the same kind of problem.
Well, thank you so much. As I said, this is government property in terms of how it has been developed and how it has been launched. And it is meant to help the supply chain so that it is, upon request, we are able to share knowledge without having to demand much, apart from maybe probably facilitation. Because at the end of the day, it's supposed to help everyone so that we don't have to either put a lot of price to it and then we are not able to gain the gains that comes up with an open source kind of a mechanism, because that's where we think we should be able to go, make it available to anybody who has who sees the value of it and be able to see how we can grow our supply chain in East and Central Africa. Thank you.
Any other questions from the judges? I see two questions in the chat boxes, so if there isn't any question, I'll ask that unless you have some.
Yeah, just another quick one. Right? Yes, yes. I heard that you are also planning to incorporate the GPS location and all of that. That could help, right? What in terms of route mapping? Is it going to be part of what you intend to upgrade? I mean, add to the as part of upgrade. Then I want to believe the distribution is within the public health supply chain, right? Public health commodity. Do you have inventory management at the point, at the service delivering point, or where these products are moved to? And are they able to link the utilization at that point to the main office, maybe also using this mechanism, so that you can, from the central location, be able to determine the utilization, and determine when you're going to have a restock, resupply to those areas and all of that. Is this part of what you are really looking at within the development of this? Yeah.
So thanks, Inato. Martin, before you respond, I think this is what the question Inato is asking, as similarities to the two questions I see in the chat box. Broadly connectivity, he's talking about connecting to inventory management. You talked about connecting to WMS. The chat function question was, is it connected to existing ELMIS? So it's basically connected to other pieces of software that run the supply chain. That's one. And second, in terms of route mapping is another application, but similarly, there's a question around, can this information be used for visualization of the product movement, et cetera? So I think these are all connected, broader connectivity of what you have into other types of supply chain software, and then taking it up to visualization. So if you could respond.
Thank you, Dr. Ravi. Yeah. Just to respond in terms of route mapping, as I mentioned, part of our management of the outbound distribution, we have a model. We have another application. I will not have brought it here. It's called RMS. It is a road management system. That is a different application altogether. that manages routes. And we are able to visualize because that one is supported by through the 3PL. So we are able to visualize and see trucks in transit. So route mapping is different from the ePOD here. Now, in terms of inventory management, the ePOD is linked to WMS. WMS is linked to other systems, data collecting systems within the supply chain. So the main operating, I would say, system we have LMIS that is linking all this. So ePOD comes in as a plugin to the larger, what I would say, the larger ERP. I just want to screen something, if you can allow me, so that I can be able to explain that point very well. You can see my screen?
Yes.
Yeah, so this is one of the systems that we have that brings in visibility at the county level. It has dashboards. This is where all the orders come on board. It's called a commodity management tool. It has a dashboard that is able to show the number of patients, for example, on RT, any order submitted to KEMSA, the reporting rates and all. So this, the ePOD is part of the many interoperable systems that exist in KEMSA. Just in Kenya, just to mention, at the bottom level, we have the DHIS, which is linked to what I have just shown you. It's called the commodity management platform. Then at the national level, we have the LMIS and the WMS, and the ePOD is linked to the WMS. So they're all interconnected, but each has different functions altogether. In terms of inventory management, that is how it is managed. So the ePOD just plugs in when you consider it in the larger, I would say, EPR interoperability, EPR system that we have in the country. In terms of routing, I have mentioned that we have a different system altogether to be able to manage that. Back to you, Dr. Ravi.
Yeah, thank you, Martin. I think we are out of time, but thank you for responding to the question. This is last call to any of the judges. If you have any pressing question to Martin. If not, we will close this session. Thank you, Martin. Thank you, Charles, for first submitting your project for consideration in price competition and coming in and delivering great presentations. And thank you, judges, and thank you, audience. We have one more prize competition presentation, which is tomorrow in track 5. So please come and join. And thank you again. And let's give a big round of applause to Martin and Charles again. Yeah, thank you. And please join. We still have the networking session. If you're still awake and available, it'll be great to see you there. So I will close this Zoom platform right now and see you later in the networking and tomorrow. Thank you.
All right, bye.
Bye-bye.